Certified Clinical Medical Assistant Exam Practice Test Questions. Question 1. According to Maslow's theory of human behavior, self-actualization is considered the highest category of need. What is considered the second highest category? Option A, physiological. Option B, esteem. Option C, safety. Option D, belonging. The correct answer is option B, esteem. Self-esteem is the second highest level, followed by the highest level of self-actualization. Question 2. Which of the following is not a violation of the Health Insurance Portability and Accountability Act? Option A, releasing patient information to a third party without a patient's signature. Option B, talking about a patient's condition during shift change at the nursing desk to the oncoming medical assistant. Option C, throwing a medical chart in a trash can. Option D, discussing a patient's case over social media. The correct answer is option B, talking about a patient's condition during shift change at the nursing desk to the oncoming medical assistant. Talking about a case to providers involved in the patient's care at the nurse's station is not a HIPAA violation. Question 3. When a medical provider asks a patient a question that requires a detailed response, what type of question is he or she asking? Option A, open. Option B, investigative. Option C, direct. Option D, informative. The correct answer is option A, open. An open-ended question requires an answer with some detailed explanation or depth. Question 4. A person who denies the presence of a negative behavior and blames it on someone else is using what type of defense mechanism? Option A, regression. Option B, projection. Option C, denial. Option D, displacement. The correct answer is option B, projection. Projection is a type of defense mechanism where a person displays a negative behavior and blames it on someone else. Question 5. Which level of Maslow's theory of human behavior entails the basic needs for food, water, and sleep? Option A, self-actualization. Option B, safety. Option C, esteem. Option D, physiological. The correct answer is option D, physiological. Physiological needs are the 4 fundamental needs according to Maslow's hierarchy. Question 6. When speaking to someone whose native language is not English, which of the following would not be helpful in communication? Option A, having a translator present. Option B, speaking slowly. Option C, writing the instructions. Option D, using hand gestures. The correct answer is option C, writing the instructions. If a patient speaks little or no English, chances are he or she will not be able to read it either. Question 7. A child who is first starting to roll over onto his or her abdomen is likely what age? Option A, 4 to 6 months. Option B, 8 to 10 months. Option C, 12 months. Option D, 18 months. The correct answer is option A, 4 to 6 months. Children generally start rolling over onto their abdomen at 4 to 6 months. Question 8. What is the most common first sign of puberty in males? Option A, enlargement of the testes. Option B, a growth spurt. Option C, deepening of the voice. Option D, development of body odor. The correct answer is option A, enlargement of the testes. The most common initial sign of puberty in males is enlargement of the testes. Question 9. Which of the following would not facilitate communication with a geriatric patient? Option A, using clear terminology. Option B, repeating important phrases. Option C, speaking slowly. Option D, keeping the voice low. The correct answer is option D, keeping the voice low. When speaking to the elderly, one should speak in a loud, clear, slow voice so that no information is missed. Question 10. Which of the following is within the medical assistant's scope of practice? Option A, prescribing medications. Option B, taking a patient's vital signs. Option C, interpreting lab results. Option D, suturing a laceration. The correct answer is option B, taking a patient's vital signs. Taking vital signs is within the scope of practice for a medical assistant. Question 11. What is the most important piece of information to obtain from a patient when taking a message for a physician? Option A, birth date. Option B, name. Option C, time of the call. Option D, diagnosis. The correct answer is option B, name. The patient's name is the most essential identifier for taking a message. Question 12. Typically, a male physician examining a female patient should bring which of the following into the examination room? Option A, camera. Option B, power of attorney. Option C, chaperone. Option D, consent. The correct answer is option C, chaperone. A chaperone is recommended when a male physician examines a female patient. Question 13. According to Maslow's theory, which levels need to be fulfilled before progressing to social needs? Option A, self-actualization and esteem. Option B, safety and esteem. Option C, physiological and self-actualization. Option D, safety and physiological. The correct answer is option D, safety and physiological. Basic physiological and safety needs must be met before social needs. Question 14. When is it most appropriate to wash one's hands when examining a patient? Option A, before examining the patient. Option B, after examining the patient. Option C, sporadically during the day. Option D, before and after examining the patient. The correct answer is option D, before and after examining the patient. Hand hygiene should be performed both before and after patient contact. Question 15. A medical assistant who is pro-life notices a history of an elective abortion on a patient's chart. What is the most appropriate action? Option A, hand the patient a pro-life brochure. Option B, refuse to see the patient. Option C, lecture the patient on the dangers of abortion. Option D, inquire if the patient had any post-procedure complications. The correct answer is option D, inquire if the patient had any post-procedure complications. The medical assistant must remain professional and focus on the patient's medical history. Question 16. A medical assistant has multiple tasks in the morning. Which task should be completed first? Option A, addressing the telephone message. Option B, filing paperwork. Option C, addressing the patient at the desk. Option D, setting up the lab tray. The correct answer is option C, addressing the patient at the desk. Direct patient care and interaction at the desk typically take priority. Question 17. A devoutly religious woman requests not to be examined by a provider of the opposite sex. What is the most appropriate response? Option A, request that she go to another office. Option B, compromise by bringing in a female chaperone. Option C, have a female medical assistant and physician see the patient. Option D, have a male medical provider examine her anyway. The correct answer is option C, have a female medical assistant and physician see the patient. Respecting religious and cultural preferences is important for patient comfort and care. Question 18. According to Maslow's theory, which of the following should be fulfilled before progressing to safety needs? Option A, achievement. Option B, shelter. Option C, friendship. Option D, personal growth. The correct answer is option B, shelter. Shelter is part of physiological needs, which must be met before safety needs. Question 19. Which mannerism would be least likely to be considered hostile or aggressive? Option A, low voice. Option B, close proximity. Option C, expressionless face. Option D, sudden movements and gestures. The correct answer is option A, low voice. A low voice is generally less aggressive than the other listed mannerisms. Question 20. Which of the following would not aid a visually impaired patient? Option A, providing a brightly lit room. Option B, using large block lettering. Option C, speaking in a loud voice. Option D, holding his or her arm when ambulating. The correct answer is option C, speaking in a loud voice. Visually impaired patients do not necessarily have hearing impairment. Speaking loudly is unhelpful. Question 21. A child who is starting to walk without assistance is most likely what age? Option A, 6 months. Option B, 12 months. Option C, 18 months. Option D, 24 months. The correct answer is option B, 12 months. Walking usually begins around 12 months of age. Question 22. A patient's son offers money to a physician to save her life from stage 4 cancer. What stage of grief is this? Option A, anger. Option B, acceptance. Option C, denial. Option D, bargaining. The correct answer is option D, bargaining. Offering something in exchange for a different outcome is characteristic of bargaining. Question 23. What is true regarding the Genetic Information Non-Discrimination Act of 2008? Option A. It prevents insurers from discriminating against people based on genetic information. Option B. It ensures schools provide necessary accommodations to those with pre-existing conditions. Option C. It prevents employers from discriminating against people based on genetic information. Option D. Option A and C are both correct. The correct answer is option D. Option A and C are both correct. GINA prevents discrimination by health insurers and employers based on genetic info. Question 24. When a provider asks a question that requires a one-word response, what type of question is it? Option A, open. Option B, investigative. Option C, direct. Option D, informative. The correct answer is option C, direct. A direct or closed-ended question requires a simple answer like yes or no. Question 25. According to Maslow, which of the following does not describe someone who has achieved self-actualization? Option A, creative. Option B, spontaneous. Option C, self-centered. Option D, open to new experiences. The correct answer is option C, self-centered. Self-actualized individuals are typically not self-centered, they are focused on growth. Question 26. 4 patients arrive in the ER at once. Which patient should be addressed last? Option A, gunshot wound to the arm. Option B, patient who is seizing. Option C, asthma exacerbation. Option D, dislocated shoulder. The correct answer is option D, dislocated shoulder. A dislocated shoulder is the least life-threatening of the 4 scenarios. Question 27. Which of the following is false regarding the Occupational Safety and Health Administration? Option A, employers must inform workers of work hazards. Option B, employers must protect employees from discrimination for reporting hazards. Option C, employers must provide employees with free personal protective gear. Option D, employers must provide employees with job benefits and vacation time. The correct answer is option D. Employers must provide employees with job benefits and vacation time. OSHA focuses on safety and health, not employment benefits like vacation time. Question 28. Which practice is prohibited by the Fair Debt Collection Practices Act? Option A, calling a consumer after a verbal request to cease. Option B, calling a consumer at 4 a.m. Option C, contacting a consumer's attorney. Option D, contacting the spouse regarding debt. The correct answer is option B, calling a consumer at 4 a.m. Debt collectors are generally prohibited from calling at unreasonable times, like 4 a.m. Question 29. A child has a broken wrist and bruising clusters. What is the most appropriate initial response? Option A, chide the child about being careful. Option B, order X-rays of the hands and feet. Option C, call Child Protective Services. Option D, refer the patient to a dermatologist. The correct answer is option C, call Child Protective Services. Signs of potential abuse require immediate reporting to authorities. Question 30. What is the medical term for a woman's first period? Option A, menopause. Option B, menses. Option C, menorrhagia. Option D, menarche. The correct answer is option D, menarche. Menarche is the onset of menstruation. Question 31. A patient is a suspected victim of domestic abuse. Which question is most inappropriate? Option A. How do you and your partner relate to each other? Option B. Have you ever been concerned about your safety? Option C. Why do you allow yourself to be abused? Option D. Is everything all right at home? The correct answer is option C. Why do you allow yourself to be abused? Victim-blaming questions are inappropriate and non-therapeutic. Question 32. Which of the following is not communicated by respiratory droplets? Option A, tuberculosis. Option B, hepatitis B. Option C, influenza. Option D, croup. The correct answer is option B, hepatitis B. Hepatitis B is transmitted through blood and body fluids, not respiratory droplets. Question 33. Which of the following is a violation of the Health Insurance Portability and Accountability Act? Option A, discussing prognosis with a power of attorney. Option B, sending records to a designated primary care doctor. Option C, keeping yourself logged into the hospital computer. Option D, disposing of documents in a shredder. The correct answer is option C, keeping yourself logged into the hospital computer. Leaving a computer logged in allows unauthorized access to patient data. Question 34. Which of the following best describes universal precautions? Option A, treating human body fluids as if they contained infectious diseases. Option B, medical precautions taken when traveling abroad. Option C, ensuring the vaccination of all children. Option D, the use of prophylactic medications. The correct answer is option A, treating human body fluids as if they contained infectious diseases. Universal precautions assume all blood and certain body fluids are infectious. Question 35. Which piece of information is the least important when taking an urgent message? Option A, time of call. Option B, telephone number. Option C, address. Option D, name. The correct answer is option C, address. While useful, the physical address is less critical than the name, number, and time in an urgent scenario. Question 36. Which of the following is not a venereal disease? Option A, HIV. Option B, varicella. Option C, chlamydia. Option D, syphilis. The correct answer is option B, varicella. Varicella, chickenpox, is a viral infection, not a sexually transmitted disease. Question 37. Which statement regarding the Truth in Lending Act of 1968 is most accurate? Option A, it limits interest that may be charged. Option B, it mandates the annual percentage rate must be disclosed. Option C, it regulates fees for late payments. Option D, it mandates businesses to work with poor credit. The correct answer is option B, it mandates the annual percentage rate must be disclosed. TILA requires clear disclosure of credit terms, including the APR. Question 38. Which medication is the least likely to be investigated by the Drug Enforcement Agency? Option A, oxycodone. Option B, pseudoephedrine. Option C, morphine sulfate. Option D, amoxicillin. The correct answer is option D, amoxicillin. Amoxicillin is an antibiotic and not a controlled substance regulated by the DEA. Question 39. Which of the following conditions is the most dangerous? Option A, croup. Option B, ankle fracture. Option C, third-degree burn. Option D, conjunctivitis. The correct answer is option C, third-degree burn. Third-degree burns are critical medical emergencies involving deep tissue damage. Question 40. What is the most common blood-borne illness in the United States? Option A, Rosella. Option B, AIDS. Option C, varicella. Option D, hepatitis C. The correct answer is option D, hepatitis C. Hepatitis C is the most common chronic blood-borne infection in the U.S. Question 41. Which of the following classes of medications would not be controlled by the DEA? Option A, antibiotics. Option B, antipsychotics. Option C, benzodiazepines. Option D, narcotics. The correct answer is option A, antibiotics. Antibiotics do not have a high potential for abuse and are not DEA controlled. Question 42. Which of the following is not a function of the Center for Disease Control? Option A, identifies health threats. Option B, regulates and supervises vaccines. Option C, develops laboratory guidelines. Option D, promotes healthy behaviors. The correct answer is option B, regulates and supervises vaccines. The FDA, not the CDC, regulates and supervises vaccines. Question 43. What bodily fluid has the highest risk for transmitting HIV? Option A, saliva. Option B, feces. Option C, urine. Option D, semen. The correct answer is option D, semen. Semen is a primary vehicle for HIV transmission. Question 44. Which situation is the best example of implied consent? Option A, rolling up a sleeve for a blood pressure check. Option B, signing paperwork for surgery. Option C, nodding prior to a procedure. Option D, verbalizing comprehension of risks. The correct answer is option A, rolling up a sleeve for a blood pressure check. Implied consent is shown through actions rather than words or signatures. Question 45. What statement best describes an emancipated minor? Option A, a person freed from control of their parents. Option B, someone charged with a crime in childhood. Option C, a person adopted in young adulthood. Option D, someone who cannot make medical decisions. The correct answer is option A, a person freed from control of their parents. Emancipation grants legal independence to a minor. Question 46. Which of the following is not within a medical assistant's scope of practice? Option A, scheduling appointments. Option B, performing laceration repair. Option C, documenting vital signs. Option D, administering electrocardiograms. The correct answer is option B, performing laceration repair. Suturing and laceration repair are typically outside the MA's scope. Question 47. Which of the following describes the ability to make one's own medical decisions? Option A, tort. Option B, capacity. Option C, living will. Option D, deposition. The correct answer is option B, capacity. Capacity refers to the legal and mental ability to make decisions. Question 48. Which of the following is a function of the Food and Drug Administration? Option A, sets drug prices. Option B, regulates dietary supplements. Option C, creates vaccines for emerging illnesses. Option D, develops new prescription drugs. The correct answer is option B, regulates dietary supplements. The FDA regulates dietary supplements and food safety. Question 49. What legal term requires a patient to appear in court with documentation? Option A, locum tenens. Option B, subpoena duces tecum. Option C, arbitration. Option D, residential ipsa loquitur. The correct answer is option B, subpoena duces tecum. A subpoena duces tecum requires the production of documents for a court case. Question 50. A physician prescribes a medication despite a documented allergy, leading to death. What crime is this? Option A, assault. Option B, slander. Option C, negligence. Option D, libel. The correct answer is option C, negligence. Ignoring a documented allergy and causing harm is a form of professional negligence. Question 51. According to Erickson, which conflict does not take place during school-age years? Option A, initiative versus guilt. Option B, industry versus inferiority. Option C, identity versus confusion. Option D, generativity versus stagnation. The correct answer is option D, generativity versus stagnation. Generativity versus stagnation occurs in middle adulthood. Question 52. Which would be least helpful for communicating with someone who speaks little English? Option A, having a staff member translate. Option B, having an English-speaking friend present. Option C, speaking slowly in a loud voice. Option D, forms in the native language. The correct answer is option C, speaking slowly in a loud voice. Speaking loudly is not helpful for language barriers and may be perceived as rude. Question 53. An urgent caller demands to speak to the physician. What is the most important initial question? Option A, what is the issue regarding? Option B, when did you last visit? Option C, can you call back later? Option D, what is your insurance plan? The correct answer is option A, what is the issue regarding? The nature of the urgency must be determined first to triage appropriately. Question 54. A physician is accused of molesting a patient under anesthesia. What crime is this? Option A, negligence. Option B, theft. Option C, assault. Option D, perjury. The correct answer is option C, assault. Non-consensual sexual contact is classified as assault or battery. Question 55. A patient with Alzheimer's gives $50 for a $20 copay. What is the most appropriate action? Option A, give the woman $30. Option B, donate the extra money. Option C, put it in petty cash. Option D, buy lunch for the staff. The correct answer is option A, give the woman $30. Honesty and returning change are ethical and legal requirements. Question 56. A woman is diagnosed with chlamydia. What should she be advised to do? Option A, continue unprotected sex. Option B, keep the diagnosis secret. Option C, assume immunity. Option D, call previous partners. The correct answer is option D, call previous partners. Contact tracing is essential to prevent the spread of STIs. Question 57. A child has a concussion and fracture for the second time. What is the most appropriate action? Option A, blame the mother. Option B, call an orthopedist. Option C, call Child Protective Services. Option D, blame the father. The correct answer is option C, call Child Protective Services. Recurrent suspicious injuries must be reported as potential child abuse. Question 58. A patient is verbally abusive and has a complex history. What can be done? Option A, send to the ER. Option B, terminate the relationship. Option C, have the patient arrested. Option D, refuse to schedule. The correct answer is option B, terminate the relationship. Providers have the right to terminate a relationship with an abusive patient following proper procedures. Question 59. Which measure may help prevent workplace accidents? Option A, dim lighting. Option B, carpeting. Option C, non-adjustable equipment. Option D, tile floors. The correct answer is option B, carpeting. Carpeting can reduce slips and falls compared to tile floors. Question 60. What Latin phrase means the thing speaks for itself regarding negligence? Option A, per diem. Option B, respondeat superior. Option C, carpe diem. Option D, residential ipsa loquitur. The correct answer is option D, residential ipsa loquitur. Residential ipsa loquitur implies that the injury itself proves negligence.